Hi, I'm Naomi, and I said that I would um, show you guys how I passed my med-surg HESI on my first try. And if you like this, I did not pass my first HESI that I ever took. So when I first took my very first HESI, I failed I got like a 617. So like a 62 conversion score, and it was not good. I stayed up all night, I cried. I then called my professor, and she laughed, and then we were getting through stuff, and she goes, Naomi, you know all this information. She's like, you're kind of freakishly smart. So I was like, oh, well, thank you. And she's like, well, it's kind of bad for you because you're trailing down these rabbit holes. And I was like, oh, crap. So in this video, I'm going to be discussing people who are one of two types of people typically with a HESI. People who are HESI question deficit, not people who are knowledge deficit. I'll talk about how to study so that way you aren't knowledge deficit on your HESI exam. Because you might know the information that the HESI exam is asking, but you might not know what is the most important, or you might not know what the test wants. So there's a couple of huge things that I like to write down on my whiteboard before I test, which help me to get in the zone, stay in the zone, and remember what is important with the HESI. So on my whiteboard, I write down ABPI. So this reminds me, where are we at in the nursing diagnosis? So if the test is asking for an intervention, I'm not answering giving a diagnosis. So if they say, what would be the intervention for somebody with asthma, I wouldn't be saying inadequate oxygen, versus versus implementation of giving them their whichever inhaler, theophylline, albuterol, whatever we're giving to them, however we're treating them, teaching them pursed lip breathing, whatever. The next thing that I put down is what would the nurse do? So this is really hard for me because I'll be like stuck between two questions when I first started, and I was like, oh, well, I would do this, but what about this, but what about this? What would the nurse do in this situation? And then my next question that's really important is, what is the safest thing the nurse can do? What is the biggest red flag? Like, what is the most important thing? Because the HESI really wants to know, do you know safety? Do you care about your patient's safety? And I say that to myself throughout the whole thing, patient safety, patient safety. So what is the safest thing the nurse can do? Remind yourself that, right? Because we don't want to do no harm. We don't want to do any harm. We want to do what's always best for our patient. So don't choose the second best thing. What is the first best thing that you can do for your patient? And then the bottom question helps me with my Alice in Wonderland syndrome, going down rabbit holes saying, I don't have this information. Well, what about this? And if you did this, quit asking that. That's not what the question is asking. Do what the question is asking, which is, with the information available, what is the best choice, right? Because I could ask questions all day. I want more information. Cool, great. This is the information you have. Make a good choice with it. And what is relevant with the information that you have? So those are my biggest tips is what is relevant? Like, your patient has headaches, but we're taught they have like an open wound. They're like, yeah, it might be related, but probably not. Who cares? Like sometimes when I read the HESI questions, I'm like, half of it doesn't even relate. They're like, the patient left home with their cat and they have 16 elephants. Like, that has nothing to do with their Parkinson's. Like, nothing at all. This is stupid. So that's kind of what I like to think. So I'm just going to do one question and how I would walk through something. So the nurse would be correct to withhold, and I got these questions off of a Quizlet. I can send the link. The nurse would be correct in withholding a dose of digoxin in a client with congestive heart failure without specific instructions from the healthcare provider if the client's A, serum potassium level is 3, B, blood pressure is 104/68, C, serum digoxin is 1.5, apical pulse is 68 beats a minute. So the first thing that I like to do, what is digoxin? It's an antiarrhythmic. What does digoxin do? It is contractibility for the heart. Digoxin goes and really helps the heart contract. So when I think digoxin, this is my little rhyme in my head. Digoxin is a toxin. So that means I'm going to be watching out for like vomiting. Halos around the eyes is a huge thing with digoxin. That's all stuff that I know. Okay, so then what would be, like, that's huge red flags with digoxin. None of that information is there. So I'm like, oh no, what do we do? So the next things that I like to think about with digoxin is it's an antiarrhythmic. So then start to think potassium. And potassium, heart, potassium, heart. Those two, like, hand in hand. If something is off with potassium, you're gonna have, oh my goodness, you're gonna have EKG changes, okay? And the safe range for potassium is 3.5 to 5.0. So, but I'm still gonna walk through this because I'm sure you're already thinking about the answer. Serum potassium level is 3. Okay, that is kind of, that's on the border, and what if there's something else that matters more? Blood pressure is 104/68. That is not ideal. Like, I don't love that, but I also don't hate that. So, I mean, yeah, but digoxin isn't a blood pressure drug. So that isn't, and it isn't alarmingly low. It's just kind of like, meh. Serum digoxin level is 1.5. So this is where it comes with, like, you've got to know this stuff. Safe digoxin levels is 0.08 to 2.0. There we go. So 0.08 to 2.0. An apical pulse is 68 beats a minute. So when I'm like, the first thing that jumps out, I'm like, oh, that's in the 60s. Well, bradycardia is diagnosed at 60 beats a minute, not 68. So although it is somewhat low, and you might consider monitoring your patient in the future for that, because it is kind of, I personally, that's where I go down this rabbit hole. If this were my patient, I would be monitoring their BP frequently after giving them digoxin. I would be monitoring their heart rate after giving them digoxin, especially seeing that it's already in the 60s, and we know that bradycardia is a side effect of digoxin. But the most important thing of why we would withhold digoxin is serum potassium level is 3. And that's because we'll start to see depressed, I can't remember if it's ST segments or QRS, but you'll start to see depressions in the EKG because there's not enough contractibility for the heart. So the answer is A. Serum potassium is 3. And hypokalemia is a very, 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 very bad thing that we want to watch out for with digoxin, because you don't have anything to pump the heart with, versus, yeah, the apical pulse might be a little bit low, and if we give the medication, it might cause some bradycardia, but we'll watch that. And that's not an indication to hold the medication. The biggest red flag for the indication to hold the medication is anything below 60. So you might want to monitor that, whatever. Blood pressure, 104/68, I'd monitor that. I'm a hawk. Serum digoxin level 1.5, I love to see that. But if my patient has already low potassium, I'm going to withhold the digoxin and contact the healthcare provider. And that is how I would walk through that question. That one was a little bit easier because it's digoxin. But make sure that you know your lab values for super important medications like warfarin, heparin, all of that stuff. If it has lab values and it is a major medication, you need to know that. So this is how I would walk through a HESI question, stuff that I really do to prepare for the HESI, when I'm taking it, the space that I'm in, the questions that I ask myself to reevaluate what is the question asking. Not what are you, like I said, I went down a rabbit hole. What are you going to monitor for when you give a patient digoxin? That'd been a completely different question. How are you going to evaluate the effectiveness? When would you withhold this medication? That's what this question wants to know. That's the most important thing.